Hi guys, welcome back to Dr. Shane's channel. How are you today? So let's have a little talk about Ozempic. So Ozempic is a medication that has recently come on the market that helps with sugar control along with weight loss, right? It starts at incremental dosages. So it's a once a week injection. It starts at about 0.5 milligrams and it can go up 0.25 to 0.5 to 0.1, and you tailor it. So you do like about 0.25 for the first 4 weeks, and you can up it to 0.5, and you can go to 0.1 and go to 1 milligram thereafter. The good thing about it is that it helps with great sugar control, and it also helps with your weight loss journey.
This is the video that you need to watch before you even think of going on Ozempic. The craziest thing that I feel like people don't realize is that Ozempic has actually been around the block for a while. But in more recent years, its off-label use has actually been weight loss. Yes, you best believe the company manufacturing this drug are making a killing. Just have a look at their stock price. If anything, I feel like Ozempic is becoming the vehicle in order for people to act out their eating disorders. Fundamentally, this is a medication. This is not a sweet, this is not a gummy. And I find it very interesting, verging on quite concerning actually, when medications become mainstream, like it's some new lip gloss. What a lot of people don't realize is that Ozempic not only dissolves fat, but it also wastes away at muscles. That's why you get that classic Ozempic face and figure. And so if you're gonna actually go on it, make sure that you're actually working out, so then you're compensating for that kind of muscle mass loss. And the way that Sally responds to it down the road is gonna be quite different to how you might potentially respond to it. And it goes without saying, the potential risks, well, the risks that we currently know about, do not outweigh the risks that are associated with diabetes and being in that pre-diabetic state. Of course, by no means are people beholden to telling every single detail of their life, but I think particularly where you're maybe a bit more front-facing, I think there's a bit of a responsibility just to let the girlies know that you're taking Ozempic. The babes out there that are watching you are going to be comparing themselves. They're like, well, I went on a weight loss journey. I'm roughly the same size as her, and actually a year later, I still haven't gotten down to the size that she is now. There must be something wrong with me. No, baby. Significant weight loss done in a healthy way takes a lot of time, okay? Where is the end point? Where is this leading to? Also, I don't know if you've been hearing, but a lot of the babes that have been on Ozempic are saying that they're getting pregnant, but particularly in the context of where they've been struggling for years to get pregnant. Potential mechanisms behind that is because estrogen is actually stored in the fat, and where you're getting that vast breakdown of fat, that then releases estrogen levels increase, and therefore making you more fertile. A really interesting seeming off-label benefit of this medication. Long story short, what I want to stress is that I'm not your doctor, I'm just simply giving opinions. And just because it's safe for insert celebrity name doesn't mean it's going to be safe for you.
It's good especially for diabetics, because if you're well controlled and you're properly monitored, you don't necessarily have to be on your medication, your tablets that you take every single day. If you are more so insulin dependent, then you will likely have to take your insulin. You will likely have to, if you're more like a type 1 diabetic. So the Ozempic helps a lot more with those type 2 diabetic type patients who are not necessarily insulin dependent. You take it, so it helps with how you have to gauge your medication. So you take it once per week. It's stored in the refrigerator. You have the pen version where you can dial up your dosage, clean the air with the alcohol. It's a subcutaneous injection. Inject it into you once per week. Or you have the ones that come in the vial where you pull up like in an insulin syringe and inject it into yourself. The pen version is a bit more expensive though. I did Ozempic I would say I tried it for a couple of weeks, and one thing you need to know is that they're not recommended for people who have a history of thyroid illness or, for example, thyroid cancer in their family. It wasn't recommend that you take it. However, when I did it for my couple of weeks, I think I lost around maybe 10 to 12 pounds, thereabouts. I did it for about 4 to 5 weeks. What Ozempic does is that it helps you lose fat and muscle, but it also, I think it more so has to do with muscle loss than fat loss. And what you have to ensure you do when you're on it is that you have to ensure that you are having a good diet, a good balanced diet, and you have to ensure that you exercise as well. You have to exercise, whether you're going to the daily walks with weightlifting as well, a balance of exercise and diet while you're on it, because that also helps with control and regulation of your sugar, and that also helps with your weight loss journey as well. So
the downside of taking Ozempic. Now, this is just what I experienced, but I'm gonna come in hot and kind of gross. And it's the brown logs, they stink way worse than the normal average. You know, when you can't handle your own funk, yeah, that type of. I think it's because the point of the medicine is to empty out your digestive tract slower. So I guess it stays in your system a little bit longer and keeps you full as well. So by the time it gets out of you, whew, pewee. Another thing is I'm always thirsty. I don't know why I'm always drinking water. I'm guzzling water. I drink at least a gallon of water a day, but that helps as well with weight loss. And just make sure you drink that water, keep that water intake going. Another symptom, which is weird, is I find that I feel like my breath stinks. And I brush my teeth every day, twice a day sometimes, and I don't never have, you see, I have pretty good teeth, not to brag, I got good oral hygiene, but for some reason, breath be hot. Also, I can't drink coffee anymore. I tried the other day and I spit it out. I think it's because it helps with people who have that A word, and so if you are you're not going to be anymore. It's going to take all that away from you.
For the couple of weeks I was on it, I was fine. People have different side effects. Some people do say that they have dizziness, they have bad dizziness on it, or they felt nauseous on it. I didn't have any side effects while I was on it, any issues whatsoever. Everybody, again, is different, so it depends on how it reacts with you. And that is why when you start it, they say to start at the lowest dose and graduate yourself up so that you can see how well it works for you. There's another medication that's similar to that they call Wegovy, sorry. It does similar reaction, similar way. So whether you want to use the Ozempic or it is similar, you just have to ensure that you read the manual that comes with them, side effects that it carries, and what works for you. Speak to your own medical doctor more about it. Out here in Jamaica, I think it's expensive. I don't recall the government covering it at this point in time, but I know it's a pretty penny for it. Especially if you get the pen version, it can run you over 100,000, I believe, and the pen lasts you up to 4 to 7 weeks, depending on how you use the dosage of the medication that you're on. All right, but overall, I had a good experience on it. It wasn't bad for me. I was fine with it. I've had 2 other friends who have used it, 3 other friends who have used it, and they have been okay on it as well. That's helped them. I've heard people overseas speak about it, and they have used it. That's helped them on their weight loss journey, and they had a good process on it as well. So I mean, it's really just up to you and how well you think it helps you. If you want to try it, ensure that you check with your medical doctor first. Ensure that you read up on it, seeing all the side effects and complications that it can or can't cause. And if it's something that fits you, then go ahead and try it. So there is a lot of hearsay that's happening on Ozempic as to whether people who need it for diabetes should be getting it more than people who are just using it for weight loss. It's really up to you. Yes, it's very, very good for people who are diabetic. Yes, it's very, very good to help them with their sugar control journey and their weight loss journey in one. Very good for that purpose. I haven't had anybody who has told me that they're on it tell me that it hasn't helped them in terms of their sugar control and balance. For people who are out there using it for weight loss, if the weight loss helps you to become more health concerned, if it helps you to get your body back into shape, if it helps you to understand more of what the weight loss does for you in terms of your health journey process, then go for it. Again, speak with your medical doctor to ensure that it fits your criteria for what you're trying to accomplish. But if it works and you can get it and it's okay, go for it. All right, guys, have a great day.